Question: how are burn injuries classified based on location? Answer: burn injuries can be classified into different regions of the body, including the head and neck, trunk, upper limbs, and lower limbs. Question: what is the significance of circumferential burns? Answer: circumferential burns can lead to compartment syndrome and impaired circulation, necessitating prompt assessment and potential escharotomy. Question: how are facial burn injuries managed to minimize scarring? Answer: early wound care, specialized dressings, and potential reconstructive procedures help minimize scarring and functional impairment in facial burn injuries. Question: what is the role of nutritional assessment in burn injury management? Answer: nutritional assessment helps prevent malnutrition, support wound healing, and enhance overall recovery in burn injury patients. Question: how are pressure garments used in burn scar management? Answer: pressure garments help flatten and soften burn scars, improving their appearance and preventing hypertrophic scar formation. Question: what is the significance of heterotopic ossification in burn injuries? Answer: heterotopic ossification involves abnormal bone formation around joints after burn injuries, potentially limiting mobility and requiring surgical intervention. Question: how are burn injuries managed in patients with limited mobility? Answer: managing burn injuries in patients with limited mobility involves specialized positioning, frequent repositioning, and pressure ulcer prevention. Question: what is the role of topical agents in burn wound care? Answer: topical agents such as antimicrobial ointments, silver sulfadiazine, and hydrogel promote wound healing and prevent infection in burn injuries. Question: how are burn injuries managed in patients with immunosuppression? Answer: burn injuries in immunosuppressed patients require careful wound care, infection prevention, and potential collaboration with specialists. Question: what is the significance of electrical burns involving the hands? Answer: electrical burns involving the hands can lead to significant functional impairment. Comprehensive assessment, wound care, and rehabilitation are essential. Question: how are burn injuries managed in patients with obesity? Answer: managing burn injuries in obese patients requires specialized wound care, attention to hygiene, and addressing potential complications. Question: what is the role of psychological support in burn injury rehabilitation? Answer: psychological support helps burn injury patients cope with the emotional impact of their injuries, promoting mental well-being and overall recovery. Question: how are deep partial thickness burns managed? Answer: deep partial thickness burns may require wound debridement and consideration for grafting, depending on the extent and depth of the injury. Question: what is the significance of graft versus host disease in burn patients? Answer: graft versus host disease can occur after skin grafting in burn patients who have received allogeneic hematopoietic stem cell transplantation. Question: how are burn injuries managed in patients with renal impairment? Answer: burn injuries in patients with renal impairment require careful fluid management, potential adjustment of medications, and monitoring for potential complications. Question: what is the role of scar massage in burn injury rehabilitation? Answer: scar massage helps prevent adhesions, soften scar tissue, and improve functional outcomes in burn injury patients. Question: how are inhalation injuries diagnosed and managed? Answer: inhalation injuries are diagnosed through clinical evaluation, bronchoscopy, and imaging. Management involves airway support, oxygen therapy, and potential ventilatory assistance. Question: what is the significance of burn injuries in homeless individuals? Answer: burn injuries in homeless individuals require special consideration for wound care, infection prevention, and addressing social determinants of health. Question: how are burn injuries managed in patients with underlying vascular disease? Answer: burn injuries in patients with vascular disease require careful assessment of blood flow, wound care, and potential vascular surgical consultation. Question: what is the role of telemedicine in burn injury follow-up care? Answer: telemedicine allows remote monitoring of wound healing, scar assessment, and providing guidance to patients after discharge. Question: how are burn injuries managed in patients with psychiatric disorders? Answer: burn injuries in patients with psychiatric disorders require a comprehensive approach that addresses both physical and mental health needs. Question: what is the significance of steam burns? Answer: steam burns can cause deep tissue injury. Management involves cooling the burn, wound care, and potential surgical intervention. Question: how are burn injuries managed in patients with chronic pain conditions? Answer: managing burn injuries in patients with chronic pain involves a multidisciplinary approach that addresses both the acute injury and chronic pain management. Question: what is the role of occupational therapy in burn injury rehabilitation? Answer: occupational therapy focuses on improving activities of daily living, functional independence, and psychological well-being in burn injury patients.
Question: how are electrical burns managed in patients with neurological deficits? Answer: electrical burns in patients with neurological deficits require thorough assessment for internal injuries, wound care, and potential surgical intervention. Question: what is the significance of burn injuries in disaster scenarios? Answer: burn injuries in disaster scenarios require triage, appropriate wound care, and coordination to provide optimal care for multiple patients. Question: how are burn injuries managed in patients with pre-existing skin conditions? Answer: managing burn injuries in patients with pre-existing skin conditions requires careful consideration of wound care and potential complications. Question: what is the role of cryotherapy in burn injury management? Answer: cryotherapy can reduce pain, inflammation, and improve wound healing in burn injury patients. Question: how are burn injuries managed in patients with congenital anomalies? Answer: burn injuries in patients with congenital anomalies require assessment of functional impairment, careful wound care, and potential surgical intervention. Question: what is the significance of electrical burns involving the feet? Answer: electrical burns involving the feet can lead to complex injuries. Comprehensive assessment, wound care, and potential surgical intervention are necessary. Question: how are burn injuries managed in patients with multiple trauma? Answer: burn injuries in patients with multiple trauma require a coordinated approach to address both burn and other traumatic injuries. Question: what is the role of burn rehabilitation in optimizing long-term outcomes? Answer: burn rehabilitation focuses on improving function, mobility, and quality of life in burn injury survivors. Question: how are chemical burns involving the eyes managed? Answer: chemical burns involving the eyes require immediate irrigation and consultation with ophthalmology specialists. Question: what is the significance of electrical burns in lightning strike victims? Answer: electrical burns from lightning strikes can cause extensive tissue damage. Comprehensive assessment and potential surgical intervention are necessary. Question: how are burn injuries managed in patients with hemophilia? Answer: burn injuries in patients with hemophilia require careful wound care, monitoring for bleeding, and potential collaboration with hematologists. Question: what is the role of burn injury support groups in recovery? Answer. Burn injury support groups provide emotional support, shared experiences, and resources for burn injury patients and their families. Question. How are burn injuries managed in patients with chronic kidney disease? Answer. Burn injuries in patients with chronic kidney disease require close fluid management and potential adjustments to medications. 1938. Question. What is the significance of electrical burns in lightning strike survivors? Answer. Electrical burns from lightning strikes can cause systemic injuries. Comprehensive assessment and coordination of care are necessary. Question. How are chemical burns involving the airway managed? Answer. Chemical burns involving the airway require early airway assessment, supportive measures, and potential consultation with otolaryngology specialists. Question. What is the role of wound care technologies in burn injury management? Answer. Advanced wound care technologies, such as negative pressure wound therapy and skin substitutes, can aid in wound healing and reduce complications in burn injuries. Question. What is the significance of electrical burns in industrial accidents? Answer. Electrical burns in industrial settings may involve high-voltage injuries, requiring thorough assessment and potential collaboration with specialists. Question. How are burn injuries managed in patients with chronic respiratory conditions? Answer. Burn injuries in patients with chronic respiratory conditions require careful assessment of airway function and coordination with respiratory specialists. Question. What is the role of telemedicine in burn injury management? Answer. Telemedicine allows remote assessment, consultation, and follow-up care, particularly beneficial for patients in remote areas or those with limited mobility. Question. What are the different degrees of burn injuries? Answer. Burn injuries are classified into 3 degrees. First-degree burns involve the outermost layer of skin, second-degree burns affect deeper layers, and third-degree burns penetrate all layers of skin. Question. What is the significance of assessing burn injury depth? Answer. Assessing burn injury depth guides treatment decisions and predicts the likelihood of scarring and functional impairment. Question. How are burn injuries classified based on extent? Answer. Burn injuries are classified based on the rule of Nines or Lund and Browder chart to determine the percentage of total body surface area affected. Question. What is the role of fluid resuscitation in managing burn injuries? Answer. Fluid resuscitation is crucial to maintain adequate circulation and prevent complications like hypovolemic shock in burn patients. Question. How are chemical burns managed? Answer. Chemical burns require immediate removal of the offending agent, followed by thorough irrigation and wound care. Question. What is the significance of inhalation injuries in burn patients? Answer. Inhalation injuries can lead to airway compromise and respiratory distress in burn patients, requiring prompt assessment and intervention. Question. How are electrical burns managed? Answer. Electrical burns require careful assessment for internal injuries, wound care, and potential surgical intervention. Question. What is the role of wound care in burn injury management? Answer. Proper wound care, including debridement, dressing changes, and infection prevention, is essential for successful burn injury healing. Question. How are burn injuries managed in the acute phase? Answer. Management involves wound care, pain control, fluid resuscitation, infection prevention, and addressing potential complications. Question. What is the significance of escharotomies in burn injuries? Answer. Escharotomies involve incisions through burn tissue to relieve pressure, prevent circulation impairment, and maintain tissue viability. Question. How are burn injuries managed in pediatric patients? Answer. Pediatric burn injuries require specialized management that accounts for growth, development, and psychosocial considerations. Question. What is the role of nutritional support in burn injury management? Answer. Adequate nutrition supports wound healing, immune function, and overall recovery in burn injury patients. Question. How are burn injuries managed in elderly patients? Answer: managing burn injuries in the elderly involves considering skin fragility, comorbidities, and potential complications. Question: what is the significance of burn wound infections? Answer: burn wound infections can lead to sepsis and delay healing. Early diagnosis, wound cultures, and appropriate antibiotic therapy are essential. Question: how are burn injuries managed in patients with compromised immune systems? Answer: patients with compromised immune systems require careful wound care, infection prevention, and potential collaboration with specialists. Question: what is the role of pain management in burn injury patients? Answer: effective pain management involves a multimodal approach that addresses both acute and chronic pain in burn injury patients. Question: how are burn scars managed? Answer: burn scar management includes scar massage, pressure garments, and potential surgical interventions to improve scar appearance and function. Question: what is the significance of grafting in burn injuries? Answer: skin grafting helps cover burn wounds, promote healing, and improve function by replacing damaged skin with healthy tissue. Question: how are donor sites managed in burn grafting? Answer: donor sites require wound care, pain management, and monitoring for complications after grafting procedures. Question: what is the role of physical therapy in burn injury rehabilitation? Answer: physical therapy focuses on maintaining joint mobility, preventing contractures, and improving functional outcomes in burn injury patients. Question: how are pressure ulcers managed in burn patients? Answer: preventing pressure ulcers involves regular repositioning, proper cushioning, and addressing risk factors in burn patients with reduced mobility. Question: what is the significance of heterotopic ossification in burn injuries? Answer: heterotopic ossification involves abnormal bone formation around joints, potentially limiting mobility and requiring surgical intervention. Question: how are burn injuries managed in patients with psychiatric comorbidities? Answer: burn injuries in patients with psychiatric conditions require a multidisciplinary approach that addresses both physical and mental health needs. Question: what is the role of reconstructive surgery in severe burn injuries? Answer: reconstructive surgery aims to improve function, appearance, and quality of life in patients with extensive burn scars. Question: how are burn injuries managed in patients with pre-existing chronic wounds? Answer: managing burn injuries in patients with chronic wounds involves addressing both the burn and the underlying chronic wound issues. Question: what is the significance of electrical injuries in burn patients? Answer: electrical injuries can cause deep tissue damage and internal injuries. Comprehensive assessment and potential surgical intervention are necessary. Question: how are facial burn injuries managed? Answer: facial burn injuries require specialized assessment, wound care, and potential reconstructive procedures to optimize aesthetic and functional outcomes. Question: how are burn injuries managed in resource-limited settings? Answer: managing burn injuries in resource-limited settings requires creative solutions, wound care techniques, and careful prioritization of interventions. Question: what is the role of infection control in burn units? Answer: strict infection control measures prevent the spread of infections and reduce the risk of complications in burn units. Question: how are burn injuries managed in patients with substance abuse issues? Answer: burn injuries in patients with substance abuse issues require comprehensive care that addresses both the burn and substance abuse related concerns. Question: what is the significance of electrical burns in children? Answer: electrical burns can lead to extensive tissue damage and require thorough assessment, wound care, and potential surgical intervention in pediatric patients. Question: how are burn injuries managed in patients with obesity? Answer: managing burn injuries in patients with obesity involves addressing wound care challenges, mobility issues, and potential complications. Question: what is the role of burn rehabilitation in promoting functional recovery? Answer: burn rehabilitation focuses on improving range of motion, strength, and function, enabling burn injury patients to regain independence. Question: how are burn injuries managed in patients with peripheral artery disease (PAD)? Answer: burn injuries in patients with PAD require careful assessment and vascular evaluation to determine appropriate treatment strategies. Question: what is the role of psychological support in burn injury rehabilitation? Answer: psychological support helps burn injury patients cope with the emotional impact of their injuries, promoting mental well-being and overall recovery. Question: how are burn injuries managed in patients with diabetes? Answer: managing burn injuries in patients with diabetes involves wound care, glycemic control, and addressing potential complications. Question: what is the significance of burn injuries in mass casualty incidents? Answer: burn injuries in mass casualty incidents require triage, rapid assessment, and coordination to provide optimal care for multiple patients.